A coalition in one Boston community has become a driving force for change. The Hyde Park Health and Wellness Initiative is working to address health disparities in their neighborhood. The group is advocating for the creation of a health center in the community to improve access to primary care, preventative care, and more. Joining me now is Dr. Nicole Christian-Brathwaite, one of the advocates for the center. Thank you so much for joining us.
Thank you so much for having me.
Yeah, let's talk about this because, to be able to create this, you had to see some of the healthcare needs. What are some of the healthcare needs that are not being met in Hyde Park right now?
Excuse me. I mean, that's a great question. And honestly, this really started around COVID when a lot of community members recognized that residents of Hyde Park were dying disproportionately from COVID and COVID-related complications. And then even post-COVID, we realized that despite being one of the largest communities in Boston, we're a healthcare desert. We have the highest rate of infant mortality out of any community in the city of Boston. And it's interesting because if you walk a few blocks away to Roslindale, they have the lowest rate of infant mortality. And we realized it's not just infant mortality. We have higher rates of diabetes complications. We have higher rates of severe alcohol abuse. We have higher rates of even asthma emergency room visits across the board. We found that Hyde Park residents are really suffering.
Wow. And to your point here, we know the city of Boston also recently released its first Black life expectancy report. And here's what it found. It found that between 2022 and 2024, Black women had an average life expectancy of 80 years, which is about 6 years fewer than other women in Boston. And then Black men had an average life expectancy of about 72 years, which is roughly 9 years fewer than other men. Now, experts say we know that that is the lowest life expectancy of all groups in their analysis. So how are these long-standing health inequities reflected in Hyde Park?
I mean, unfortunately, when we look at the data, it's terrifying because it almost seems that your zip code can predict your life expectancy even more than potentially your genetics. And if you are an African American or Black, and if you live in specific communities in Boston, you are dying earlier, you're suffering more, you're having to travel much farther to seek care. We have excellent healthcare in Boston. I trained at one of the best hospitals, but there's not equal access to it.
You raise a good point here. We know that the Health and Wellness Center initiative has a comprehensive approach. You hold an annual Health and Wellness Summit. You also have other events, partnerships. So what are some of the key points of your strategy here?
That's a great question. I mean, one, as you said, is building those partnerships. We have been so fortunate to have such incredible support from our elected officials, from Enrique Pepin to Ayanna Pressley to Liz Miranda. And many of our elected officials are showing up at these events and speaking to residents and community members to find out what's needed. Right now we're in the information gathering stage. We want to make sure that whatever we create and we build is for us, by us. Our community needs to have a say. And eventually, long term, our goal is to have a brick and mortar facility that offers comprehensive health care, that can offer guidance around food and housing and even economics. But to begin with, we're gathering the data and we're looking to partner with larger hospital systems to even initially bring mobile health care to Hyde Park.
When you talk to the residents in Hyde Park and they hear what you're doing, what's been the response at this point?
It's been overwhelmingly positive. I mean, frankly, the response is finally.
Yeah.
What took so long? We need this here. And we also recognize that it's not just access. At our most recent summit, we also had the Hyde Park Food Pantry, because we know that social determinants of health and inequities also contribute to unequal outcomes. And so it's not just healthcare, but it's addressing the housing crisis. It's addressing food insecurity. And we're really working, as I said, to create a comprehensive entity that can really support all of our residents. But people are ready. They have been more than ready.
Yeah, absolutely. Let's talk about the timeline here, because it does take time to create a center like this. So for folks who are watching and community members who are waiting to see this all come to fruition, what is the process like right now? I know you're in the information gathering stage, but how long do you hope this will take for this to be complete?
You know, that is a great question. We started the process in 2020 with just a conversation and working with, again, the Mass League of Community Health Centers. And realistically, this process can take years.
Yeah.
It's a matter of garnering funding, which obviously is the biggest concern, garnering partnerships, identifying a location. And currently the landscape in politics and healthcare is more about removing funding than adding funding. And so we recognize that probably now more than ever, there will certainly be barriers, but that's not stopping us from at least beginning to explore options. Truthfully, we're probably years away from opening our doors, but we're still finding alternatives.
Really, it's amazing, though, because it goes to show you see a need and you try to solve that problem. So we really appreciate your time and what you're doing in Hyde Park. Dr. Nicole Christian-Brathwaite, thank you so much.
Thank you for having me.
Thank you. Well, coming up, closing a care gap in another country, how a local group is making a difference on the ground in Haiti.